Hello, I'm Neil Linticum. I'm an orthopedic surgeon at Ortho Kansas, specializing in hand surgery. So pretty much anything to do with the upper extremity. It's not as bone specific as some other areas of orthopedics. We do a lot of soft tissue work with, tendons, nerves, arteries, skin. So that's one of the other attractive things to me about the hand surgery. We definitely take care of the bones and joints, but take care of all the parts of it. So we see a lot of injuries. The hand is the most common reason to present to the emergency room for an injury, and so there's a wide variety. You'll see a distal radius fractures, the most common fracture. We'll see cut tendons, cut nerves. People get their hands lacerated for any of a number of reasons. So they're pretty common. So I think just be smart about how you use your hands. Be aware of where they are when you're working around things. Trailer hitches are a real common injury. People are pushing on it or moving. As we talked about in the kitchen, if you're chopping things or using a mandolin slicer, any of those things that you're using, and in the workshop around tools, there's lots of exposure because your hands are almost always involved in what's being worked on or the tools that you're working with. So I think just being aware of where your hands are and being smart about how you use whatever things that you're working with. So there's lots of conditions in the hand injuries that are very time sensitive. If you're repairing a cut nerve, they do much better within the first 7 to 10 days. The longer they go, the less potential for recovery. Tendons can draw up and be harder to get back together. And as joints get stiff, they're harder to get moving again. So a lot of injuries are very time-sensitive. Fractures, if they start to heal out of place, may require more invasive or different treatment than if they're seen right away. So it's important that you get things checked. The myth of, well, I could move it so it's not broken has cost many people time, money, and risk, making their treatment more involved. So it's important that if you have a significant injury to get it checked out. It's a great option for a lot of diagnoses. Good therapy can, one, get you good relief, and two, it can oftentimes save you needing a surgery, you bet. And so there are lots of times where a good hand therapist or a good physical therapist can get you fixed up and save you having bigger problems, get your function better, get your symptoms relieved without having to do invasive surgical things.